Days before the holidays, hospitals across the country are seeing a rise in COVID and flu patients. Here in Nevada, hospitals are in good condition, according to the Nevada Hospital Association. In Clark County, the overall occupancy rate for beds is 86%. There is a demand for pediatric beds. 94% are occupied. Sunrise says demand has eased. UMC says they are at normal levels for this time of the year. The CDC warns providers in other parts of the country children's hospitals are nearly full. Hospitals across the valley tell Fox 5 they are thankfully not seeing the surge of RSV cases that they saw last year, but they do expect even more children to get sick after Christmas. Doctors break down if your child gets sick, when to go to the hospital.
They are spreading the love, and they're also spreading the viruses to each other.
'Tis the season for COVID, flu, RSV, and cold season. At Dignity Health St. Rose Dominican campuses, doctors say they've been busy treating sick kids since Christmas break. Children's units and hospitals across the valley expect more patients after Christmas.
It's always scary when you have a child who's sick. When is your child sick enough for the ER or sick enough to stay home? I think that's a tough choice.
Fox 5 asked Dr. Lindsay Vanderland of the Siena Pediatric Emergency Department, when is it time to take your child to the hospital? Dr. Vanderland says ER is a must if your child has difficulty breathing, is lethargic, or vomiting and can't hold down liquids.
That's definitely a time to come to the emergency department. You don't want to wait till the next morning.
What if your child is just starting to get sick or has a fever and still wants to play? Dr. Vanderland says you have several options. You can start to treat at home with Tylenol or ibuprofen, hydrate with Pedialyte or Gatorade, visit urgent care, and if you have questions over the weekend or the holiday, call your pediatrician. An on-call doctor should call you back.
But I think in the beginning of the illness, it's okay to take some time to try to figure it out. I think your pediatrician is always a good resource.
And Dr. Vanderland also says starting Christmas, hospitals are going to get a spike in visits when kids try out their brand new hoverboard, skateboard, or bike. She says after your child gets that new present, have parental supervision, hold their hand, and have helmets and elbow pads.